So our next session is on how to conduct the in-depth interview. Again, I said that it's an art, and once you do like 3, 4, 5 qualitative interview, then you will come to know that how to conduct a good interview. It is something which you cannot learn until you do and you see your own transcript. Then you'll come to know. So there are many methods of data collection in a qualitative research. The main is the in-depth interview. The other is the focus group discussion. Next is the participant observation also, which we do in the ethnography. Due to lack of time, we are covering the in-depth interview, but we'll share the recording of focus group discussion also by today itself, so that you can see that since in this workshop, you all have to conduct an in-depth interview. So we are telling you the steps of conducting an in-depth interview. So this is just an analogy of conducting an interview and driving a car on highway. So like if suppose you want to go to a holiday destination and you plan to go complete this journey by car, then what all do you need to plan ahead of this journey? So conducting an interview is like driving a car on highway, like we have discussed in the beginning, and we'll see how this driving a car will be equal to conducting an interview. So like first thing is, we have to come out of this mindset of data collection. Why I'm emphasizing on this, like when you go with a paper and a pen, and of course you should have interview guide. I'm not saying that you should not have the interview guide, but generally, if you like constantly seeing at the interview guide and taking the interview, then there will not be a rapport building with the person. So ideally, you should, I should not say practice, but if you conduct interview with your own colleague, like we encourage our students, like our PG students, to conduct these interview with their friends in the department. And when they conduct 3, 4, 5 interviews, then they go to the field to conduct the actual interview. Because by that time, they kind of remember the main RQ or the main questions which they should be asking. And in the meantime, you can refer to the interview guide also in between. But it should not be like you are holding a paper in your hand and constantly seeing the questions and then asking one question and then coming to the other question, then asking the next question. Not like this. So because you are going to have a talk with the person. So all those components of a conversation, like your open body language, your eye contact with the person, a kind of open the way you sit with the person, like square legged and all, and you should not have like closed body, locking body positions. So all those component of the non-verbal communication, principle of non-verbal communication should be kept in mind, and especially the distancing with the patient. It should be with the appropriate distance. It should not be very close or very far. So approximate, like we say, like 1 hand distance with the person. And the second thing is the eye contact, which is very important. And again, like we discussed regarding the paraphrasing. So in between, if you paraphrase, in a way, you are also summarizing the content to the participant, and also you are making them feel that you are listening to them and their statement is valuable to you. So these concepts should be kept in mind whenever you go for doing the data collection. Second thing which we have discussed, it like memorize. You have to memorize your interview guide roughly, not every questions, but rough. In between you can check, but it should not be like a quantitative, where every time you are seeing the question and asking from the respondent. Then third,
can I ask a question?
yeah, sure.
No, as I said yesterday, does one person conduct the IDI, or it's appropriate to have an assistant?
Actually, generally what we do, 2 people are there. One
Yes,
person
exactly.
is there to manage the recording, to keep away everyone from that place. Otherwise, what happens in a PHC or a place, if somebody is seeing that 2 people are conversing, then everyone will keep coming in and asking one or the other thing. So
right. So does anybody take down the response as in write it down,
Yes.
or we leave it to the recorder, the
No,
recordings?
no, there are two, like there are roles and responsibility defined for both the person. The other person who is managing whether the recording is being done accurately, it is button is on, the battery is okay, it did not get off in between. And
Right.
again, other
Will
person
he or
not.
will he or she be writing the responses
Yeah,
for the main interview?
I'm coming to your point also. Yes, and she or he has that note, like a copy and a pen, and she keeps on writing even the gestures, like the person got sad in between, and where if he starts crying in between, that also she records, and she keeps a record
Right.
of many questions, which
Right.
the person who is interviewing, he it's difficult for him to write as
Right.
he's paying attention towards the patient verbatim. So
Right.
what
Right.
the
So
other
the
person does, if some new inquiry has come up, but that needs to be asked at the later point. Why? Because if he interrupts in between, there will be a loss of flow, what the
right.
person is saying. So the other person keep note of all those questions which should be elaborated. So it's basically a teamwork. So
Okay.
because
So the
both,
signs and symbols are done by the assistant. The brackets, the dots.
yes. Ideally, see, exact signs and symptoms, these brackets and dots, these will be done when you are transcribing the interview, you are doing the transcript. But some major event, you can,
Okay.
that person can record. And like overall, what we call it as a field note. Field note means what is happening inside, like if some relative is coming in between, or if the wife is also there with, like in my case, there were couple, because generally HIV, it's both the couple who got infection. So I was
Right.
interviewing the main person, like husband, but his wife was also telling in between the responses. So in that case, like the person who was there with me, he was recording, like this was the sentence of his wife. So his wife was interrupting in between, or overall feel note, like what the like when she was saying, she was like showing her eyes not to say disclose a particular thing.
Oh, okay.
Through
Right.
gesture, she showed that no, don't disclose this thing, something, but which did not come in the recording. So
Okay.
those things, like the other person keeps a note.
Right. Okay. Thank you. Thank you.
Okay. So test, you have to test and practice the initial interview guide with your friends. So the participant, if I ask, like, you have to respond that if the participant says that I am ready to give this interview, but will you share this interview guide with me? So what will you do? Yes, we discussed this question yesterday also. So Dr. Abdul is saying no. Okay, but what is general practice? That you should give the interview guide. You can have extra copies of interview guide. There's no harm. If the, like in our case also, many people, like when we were taking interview of the district immunization officer and the state immunization officer, they asked for an interview guide beforehand. Then we sent them the interview guide beforehand, and then we went to the next day taking the interview. There's no issue because it's very open and flexible process, and there's nothing to hide. Even if they want to have an interview guide, even the patient, you can share the interview guide with them. There's no issue. Even the quantitative one also you can share, because what we are asking, it's just their perception. We are not doing some forensic, investigation of some criminal cases. It's just the, regarding exploring their perception, their own perception, and you have taken a consent also that they are ready to participate. So yes, you can share. Again, coming to the location of interview that we have discussed, there should not be a par issue. Like if you are doing it in a village, like in Bihar, what in all districts, when there was a ban in alcohol, we conducted the qualitative, this focus group discussion in 38 districts. Like some representative, not 38, I guess maybe 17, 18 districts. in an area, and in each district we conducted across around 6 focus group discussions. So there was a problem in choosing the location of the interview, because if you choose something like Anganwadi, and if there are people, that in a village there are issues of religion, there are issues of caste and creed, and a lot of other this thing plays a role. So then we had to choose something neutral. Like in one case, we chose a place which was like we call it as a community center, Samudayak Bhavan or community center. So most of the place we tried to choose, or some open space near a tree or beneath a tree, where there was a place where we all could sit and talk. So something like that, you can choose a neutral space where the people, and you give the invite to people beforehand, like who will be there, who will be like acting as your person, a key person in your FGD. So those people are identified beforehand who will be there. So that should be a neutral place wherever you take the interview. Like if you conduct this in a Mukhiya's house or Sarpanch house, and then if you are asking an issue related to village, so he will not come up with anything negative, because he will be afraid that, I'll be caught answering these things. So that's why it should be a neutral place, and there should not be anyone else apart from the 2 people who are taking the interview. And one person or many, if she's a female, usually they are like accompanied by their husband or by father or someone. So they can sit, but you instruct them like not to say generally in between. But if she feels that she should ask, definitely you give that much freedom to her to discuss something. Again, coming to recording, like there should be you have to charge your, there is a recorder, so you should charge the battery of your recorder, or you should charge the recorder. You should check the functioning, it should be in functional status, and you should have memory, because what you have to do, if you record it, you have to transfer it to your own system, otherwise that memory gets exhausted. So you check for the memory, how much space is there, and how much is the allowable time through for which you can conduct the interview. And for backup, you should always have a backup. So what generally we do, we take recording on phone also, because all of us have a smartphone these days. So we record on phone, and we have a recorder also. And generally when you record on phone, you should keep it in aeroplane mode, otherwise if any call will come, that recording will get interrupted. And in the for the recorder also, if you are recording something, and if like patient, if there is some disturbance, like both the couple have started talking to each other, then you can, there is a pause button in the recorder, so you can press the pause button, because then otherwise when you will do the transcript unnecessary, you will be wasting your time in understanding that when it again restarted. So you can use the pause button of your recorder if some disturbance or anything unusual happens, which is not beneficial for you as a data collector. So that you should keep in mind. Then you have just started, so you should start the recording just before taking consent for interview. So do you agree with this? Yes. So generally I said that you can take many times, we take the written consent and we take the audio consent also, that are they ready to give the share their information. So yes, consent can be recorded also. True.
Ma'am, have one query. Hello.
Pardon? Yeah.
Ma'am, I have one query regarding recording. Can the recording be handed over to the interviewee if requested by him or her?
Yes, yes, bilkul. You can. Everything, whatever they request, you can definitely share, because it's their recording. You can share if they wish. You can send them over these days, so you can transfer it. You can send them. We cannot say no for anything, because they are just asking what they said. So questionnaire, participant information sheet, their recording. If they want the like recording to be like transcribed one, so I always said that it's usually you should send them the written what they have said. But generally in our case, they are not that much literate, and then again going back to them, it's little difficult. But again, if you like what we are thinking, that we will do the same, like even if it is he's illiterate, we might hand over them the copy of the transcript. So Dr. Latika is asking what to do when they are ready to give the interview, but don't want. Yeah, this happens many times. That they will say that please don't record. Especially this happens with people who are at higher position. Like if you go and talk to a medical officer in charge.
Yes, ma'am.
So they will always say like, please don't record. So they are very apprehensive. Like, I don't know what they will say or what they will record. So that's perfectly fine. Like we did one qualitative interview of like, there was an initiative which was like Swasthya Mitra. With the Jivika, there is a Jivika cadre in Bihar, which is like a self-help group. So regarding that Jivika, their role in the health center, we interviewed a medical officer and medical officer in charge and civil surgeon also. So like there was one civil surgeon who agreed to give the consent and we could record their verbatim, but many times they say that, no, don't record. Then in case what you should do? So yes, you should not say that you are not going to take their response, because their response might be very important for you. Although, so there is a limitation, you will not have because we are also not that much smart in taking notes that fast. But yes, if there are two people, so what you can do, like the other person can take notes. And in that case, I don't know whether if there is any support of your organization regarding these people who are shorthand and like, very much skillful in recording the observation. Like in our office, generally we found 1 or 2% is there who can do this job. So you, again, I will say that yes, it can be. Like you have written stenographers. So you don't record, but you take their response. You take the notes and like I recently I saw one girl in my organization who is very smart in taking notes. Whenever like we are saying something, using that again, like Dr. Tapubrata is writing. So you can ask her, you can pay something to them as a part of the research because they will be helpful to you. So in that case, but then you have to plan because she will not be accompanying you every time. So you can take time and you can ask beforehand whether they are willing to get their interview recorded. Or if not, you can again come to them tomorrow, next day. Because maybe if I've gone right now and I don't have that person who will take like shorthand notes for me. So what I can do, I can again revisit the person tomorrow.
Okay. And also, ma'am, sometimes what happens, like you just finish the interview, and while you're discussing and start like ending with it, something else comes up in the interviewee's mind, and they speak something which is like essential and important.
It's very
How do
important.
you include that?
Yeah, so that happens with us also. That's known. There's a phenomena. I think door locking or some. It is known as a phenomena. Like when you are just about to leave, then
Exactly.
he will come up with something very interesting which he has not said earlier. Because
Correct.
when you are recording, then they are very apprehensive and very guarded what to say. But when you, but in that case, what you can do, you cannot hide them. You can write it, and then you can take the permission from them. Like, sir, you have said this. Can I use these sentences in my analysis? Because without their permission, you cannot.
Okay.
So, because it happens with us also, like when we switched off the recording, that person came up with a lot of factors regarding the system, the problem with the system, because it was related to vaccination. But then he said that, though, please, I'm saying these things, but don't put these things into the analysis. So I said, okay. I did not include that because ultimately the person consent is required whenever.
Matlab, we can make it a part of a transcript if they give us the permission.
Yes.
Okay.
Without that, you should. It's unethical. You should never. And they say, many people, they say there is no problem, you can use. Because there was one deputy superintendent who said, yes, madam, you can use everything. I don't have any fear from anyone. On the contrary, there was one person who said that please don't use these words because I don't want to be in soup. Although, the way they perceive things, again, it's the multiple reality.
Thank you.
Okay. Then again, we have discussed this, that you should ask the there are two terms. There is one probing and there is one prompt. So basically prompt is to helping them. Like if you ask, let's say, regarding this prompt, if I ask from them, like what are the barriers which they perceive in their daily way communication? If they're not coming up with anything, then I might say like, during your interaction with patient care, like when you are writing a prescription or when you are suggesting some things, giving them some advice. So like advice. So this advice will be like one prompt of a patient-doctor communication. And probing is like further interrogating, going deeper into that particular context. So like consider yourself as an interviewer. So what next question you should be asking to the interviewer? So like if this is the question, like how has the patient dementia impacted the relationship dynamics in their family? If this is the question. So what next question you would like to ask to the respondent? So like if the respondent says this, like my mom requires 24-hour care and I'm often stressed out about this and it is putting a lot of strain on my marriage. If this is the question, if this is the answer of the respondent, what should be the next question? Yes? Please type in the chat box. Yes, can I see the chat box? How do you address this challenge? So again, this challenge. So which challenge? Who are the other family members who can take care of your mother? What's your partner take on it? Okay. Dr. Latika, it can be a probe like, please describe more in detail how it is impacting your marriage. Okay, good. Yes. So ultimately you will see that you need to dissect these. Like maybe I have this as a written form. When they say it, again, you have to be very attentive and patient. Like she says 24-hour care. You can elaborate on this 24-hour care, this term. What do she mean? Again, when you take interview, don't assume that you know everything. Assume that you are a lay person and you don't know anything. And that's why try to have the perception of the person, because you have got this image in your mind regarding 24-hour care. Maybe if I have seen a patient of dementia, I know what care is required. But if the person is saying that my mom requires a 24-hour care, now your next question is to probing this 24-hour care. Then you can ask like, yes, can you elaborate more on this 24-hour care? Like what all care do you have to provide? And what about like sleeping? Can you like, then it will be like more focus on 24-hour care. And after this, again, like Dr. Latika said, about the next part, which is like putting a strain on my marriage. So you can elaborate this part, like what do you mean by this? Like strain, what type of strain? Is it in the relationship, or with how is your relationship with your husband because of this dementia? So these things you can ask whenever. So my take is like, you should dissect and you should have a probing of each of these vital part or vital text which you can see here, like 24-hour care. Or maybe if it is writing like I'm often stressed, you can also elaborate on stress, like what all stress she feels, like maybe elaboration on stress. So that's how response to one question will lead to many of the other questions. And you should have a further probing, digging deeper, if you want to explore the, perception or the relationship dynamics or something like that. Yes, Dr. Abhijit is writing how to help overcome this shyness or hesitance to respond to critical questions. The only thing is your body language and your patient looking face probably, and your eye contact. And I guess if you have got a very positive aura and if the person is speaking, see, it is the purposive sampling. So you should select a person who you think that they will speak. Because if in during our experience also we have seen there is a lady who's not speaking at all. For everything he's saying like ask from my husband, or I don't know anything, or you write whatever you feel like writing. If such responses are there, then you should not take that person as an interviewee, because then otherwise you will not get anything. So yeah, Ekta is writing, what are the problems you face? Okay, dementia. So you can elaborate on these terms. And again, I said that don't have your own mental image. Don't think like if I know something by this word, putting a strain on my marriage, I cannot assume that the same thing is happening with that lady. So in case of whenever you are going to take an interview, consider yourself as a most like you are a lay person who doesn't know anything. Otherwise, what happens generally as a medico, we think that we know everything, and we kind of we make judgment, and we think that whatever they are saying we already know. And then let's see. Just a sec. So these are the questions which we have seen. Again, if you consider yourself as an interviewer, if I ask this question, like, why do you prefer the auto-injector to intravenous injection? If my next question, the answer is this, that the auto-injector is more convenient because I can administer it at home and it takes less time. So again, what next question can you ask? Again, don't think that what do you mean by less time? You don't take your conception of less and more time, because perception of time, it is also very different for different people, and convenience is also different for different people. So if you have to ask a hypothetical question, what question can you ask in this case? Auto injector, you can ask like, if you use the intravenous injection, what difficulty you can have? So if you say this, that is coming. Yes, so can I see some more questions? What next question are you going to ask? If the response is like, the auto injector is more convenient because I can administer it at home and it takes less time. Okay, Dr. Tapopata is saying, why do you feel it to be convenient or inconvenient? Yes. Or you can ask, yes, absolutely right. What inconvenience it causes to you? Like he said, I can take it at home. Apart from taking it at home, what all inconveniences or what all conveniences you face? What if you are working in an office? Are there safety status at home? Okay. And again, yeah, that is very important. What do you mean by less time? Like how much time it takes with the IV injection and how much time it takes with the... So that time is very important. So you can ask questions. So again, the same thing, you should dissect all the words which they are saying. Maybe the convenience or maybe the time. You don't think and don't be judgmental that, what is less time for you is less time for them. Then again, what do caregivers observe? What signs do caregiver observe that tell them their loved one is having an asthma system? Okay, Dr. Mukherjee is writing how much time it takes for an IV as compared to auto-injection. True. This case, what signs do caregiver observe that tell them their loved one is having asthma symptoms? If the answer is like, I know my daughter is having a hard time with her asthma system, with her asthma when she is wheezing. What next question you can ask? Yes? Please write in the chat box. If this is the response, what should be the next question? Yes, so how do you feel in hard time? Very good. And again, you can elaborate on hard time. Yeah. Why do you think it to be hard, or can you describe more on this hard time? And you can say like, I am unable. You can also say to them that I am not able to understand. Can you help me in understanding this hard time? So if you behave you, like you are at a lesser role. Lesser role means you make them the teacher and you become the student that you are not able to understand. Then they will try to explain it in detail. So similarly, like Dr. Priyanka is writing how your daughter would spend time if she would have asthma. Okay, yes, this is one hypothetical question, like framing the other way around, that can also be done. So you may ask question about, when we say that same question in some different way, but again, this is again improving on your previous question so that the person is understanding what you want to say. And again, we say that it's very good to ask silly questions. Why I am saying this? It's good to ask silly questions because what you think is silly may not be silly. Because again, silly questions is like depending on the level of experience. So if a child is asking a question, it might look very innocent and silly to you. Similarly, think of a patient who is not very literate and who doesn't have much experience, and you are thinking that you are very experienced. So don't shy away you yourself from asking silly questions. Yes, that might elicit very good responses. And Dr. Tapubhata is writing, yes, to express the lesser role. Always remember, don't go with this notion that you are superior to them, because somehow that comes in our body language, that we are at a higher level to them. And that's why we always say that whenever you do the FGD, you sit on the same ground. So in the villages, we sat on the soil where they were sitting, so that they should not feel that we are different. And our body language should convey that we are one among them. So then only, they will have trust. So raising this trust on the interviewer, that is, if that is established, then you will get a very good response from them. So again, this is one activity, read the reply of participants. So participants say that the doctor came very late. Again, this is the time of perception, like came late. Late how much? Half an hour, 10 minutes, 1 hour, 2 hours, something like that. So if doctor is saying like, I usually remain engaged in department meeting after lunch. If this is the question, so your next question can be like, what is, engaged in department for how long? Or for what do they mean by what type of work they do in the department? So similarly, you can elaborate and probe more. Again, the idea about asking these silly questions, that we are not going to assume what we already know, or the terms or terminology which we understand is the meaning of, because in the beginning we said that it is the multiple reality. So what do you understand by this term? It may not be the other person who will see that particular term or phenomena with the same respect. Now coming to the note taking. So note-taking process is like we said, there should be two people. So the other person is taking the note simultaneously, important one, and he is also helping the main interviewer to ask some, like if the main interviewer forgot to ask something, then the other person helps the interviewer to ask few questions. And he should be like vigilant. And again, I said that he's recording some new questions also, which came during the process of interview. So then he also can ask. It's not necessary that he will ask the first main interviewer to ask. So if he feels, he can also ask in between. And that depends what is the, these three people, their bonding is during the process of interview. So again, after the interview, you should say thanks to them, and you should always write reflection. Reflection means the overall process of the interview, because these reflections will help you in writing the discussion. I'll tell you, during the analysis part and during the this data collection part, in case of a qualitative reflection, writing your own reflection is very, very, very important. And if you don't write, if you will forget it, because you don't. Yesterday we learned about memories, now that you think that your recall is good, but actually our recall is not that good. So that's why you keep a log like a diary with you whenever you go, and with date you should write your reflection. Like suppose I have gone today to collect 2 interview or 1 interview or 3 interview, I'll write my overall reflection of that overall interview process, like maybe the situation at the PHC or what was my experience. So what it is like writing your own brain on the piece of paper, because there is a thought process which is going in our mind, and you should write that in a diary. And if you keep on writing every day 1 page, because your research is generally around 2 to 3 months, a qualitative research, taking all the process like data collection, the approvals, and it depends how fast you do, whether you have got only 1 work or if there are multiple work, definitely it might get delayed. But again, try to record your reflections in a diary or in a tab or in a phone. If you don't feel like writing, you can record your own voice. That also we tried many times. Like I usually do, like if I don't feel like writing it, and if I'm thinking that I'm too tired, I just record my own voice, like what I have thought. And then you can transcribe it as a reflection also later part, because transcription is easy. Writing many times, if you're in the car, you don't feel like doing it. But again, at least you should record your own reflection about that interview process, about overall what you have noticed extra, apart from what the note taker is taking the note, and the interview, you have got a recording of the interview. Okay. Now this Dr. Neha is asking regarding what should be the duration of the interview. It should be completed in 1 session. So yes, depends. The answer, now I will answer first my answer to the first question, duration of the interview. So there is a very wide variation of the duration. It depends on the person, how much insight he has, or what is the quality of the interviewer. It may range, and you have to give this duration in the write-up also. When you draft a report or when you submit a manuscript, you give the mean duration of recording ranging from minimum to maximum. So we had interview where it was like 7 to 8 minutes also, and we had interview where it was like 1 hour also. But in 7 minutes also, if you have got some very valuable insight, that is okay. And that's why I said that there is no such rule. Even in 5 minutes, if person is very like he has started with the interview and he has given you a very important some hint or some perception regarding anything, and then again, especially with the women, it happens, and the child started crying, because we interviewed few women for the RSV vaccine uptake. So because generally they were the young mothers, so they were like children, small kids was there with them. So if the child started crying, then they were in hurry. They said like, I cannot stay here for more time. I have to go. In that case, because she is not going to come again, and you are not paying them also for the travel. So generally we don't ask them to come again. Maybe if generally you should take their phone numbers, and you can ask them like whether they are planning to come anytime to the PHC or to AIMS or to your hospital. And then you can talk to them, you can have a timing, prior appointment, and you can go again to complete that interview. So it depends. And yes, in session also, like we conduct during I can tell you my experience, generally we have conducted all the interview in one session only. We did not call that person again. Yes, but for like some information, if I was not able to ask at that time, I was having the phone number and you may call them. And if it is the same lady who, like they remember you well, because the interview generally lasts for like 15 minutes to 30 minutes. So they remember you. So you can introduce yourself and then you can ask. I don't know how much, whether they will recall or not, because this process we have not done. But yes, it is said that you can do this process of calling them, or if they are coming for some other purpose, you can set a time with them and you can like have a prior appointment. So Dr. Latika is asking, where should we write the reflection in the publication? Yes, it comes in the discussion part, because in discussion, I said that author constructs this whole story. Construct means like what is the viewpoint, like after that analysis or transcript, you have to have discussion. So discussion, it is not necessary. Generally what we write in quantitative, you write that what the other authors have said and how your research is different from the other authors. But in the case of qualitative, generally you give your own viewpoint, and having those reflections help in writing the discussion. So you don't include that discussion as such. And many times, if you like read the Saldana, they said that you can code these your own reflections also, and your own field notes also. Like, because you are also, as a part of, you are also a stakeholder. So apart from this thing, you can also code your own field notes and your own reflections. But generally, I have used this for drafting the discussion. I did not code my own this thing, but I have used it as writing discussion. Okay. So, yes. Any more questions? So being a good interviewer means you should have a good knowledge about the topic of interest. You are structured and you should be clear. The questions which you should ask, it should be open. And like we say, it should not be having too much jargon. And if you can speak their local dialect, that will be very easy. Because many times what happens that they understand Hindi, but they cannot speak Hindi. So then they will speak some local dialect like Bhojpuri. Then it is also okay. You can get them recorded. But again, you should have these ideas from the field. And you can accompany few, like in one of the project, we asked few of the interns who knew like Mathili and Bhojpuri, and they helped us in like reframing questions, so that you can take help. And you must not think again, I said that you should be very gentle, patient, listening to them. Your body language should not be in a hurry that, you don't have time. Attentive listening, sensitive, these are some of the traits. You should be open. And this is like steering. Like one example we said in the beginning, that it should be like driving a car on the highway. So you are driving and you are making all the preparations in the beginning. Like when you drive the car, you check with the stepney, you check with the petrol, the fuel, whether it is there or not. And you check about other logistics. If it is a long drive, then you should have eatables also, water, everything. So that similarly with the interview, when you start with an interview, you check for the notes with the interview guide. You should have separate copy. You should have a informed consent, written informed consent copy with you, all the recorders, their battery. And then we use a two-way this thing also. There's a two-way connector. If you use, then the quality of audio comes good. Because one connector is there with the person who is speaking and the other is there for the person who is responding, means asking questions, interviewer and interviewee. So that way the quality of voice or audio comes good, especially if it is like in the PHC or some health facility where there are a lot of noises are there. So you can use those electronic gadgets. You can check what all will be helpful, because a good sound quality, if there is a lot of disturbance in the background, you will have difficulty in transcribing the interview. Again, this is very important. be very neutral in your voice and tone. You should not be judgmental, especially with something like if if the person is saying in vasectomy that I don't like vasectomy, why we should be like, it's the women work who should be going for the contraception. It's not the men's responsibility. If someone is saying this, and then you don't start like, why do you think so? Why it should not be the men's responsibility? So if you don't observe your own emotions, at times you be in the flow with the person and you start like maybe having altercation with the person, then that's the end of the interview, because then he will understand that you are not into tune with that person, and that will inhibit him from saying anything else. So keeping a neutral tone, and don't agree also, because if you agree and if the patient captures your agreeness, then he will say more thing to please you. So ultimately, your body language is very important. And I'm telling you, initially, we all have made a lot of mistakes, because you try to become doing the preaching also in between, that you should not do like that, you should do like that. It's our habit, general habit. So I'm saying that just be a very neutral person. Don't agree or disagree whatever the person is saying, and just focus more on asking more questions and probing rather than being judgmental during overall interview process. And if any ambiguity is there in the statement, then you should clarify that. Again, we are steering because it's the interviewer who is steering the overall process. So if there is a diversion, or if there is a, like in case with the highway, if there are multiple routes also, then you should try to maintain the main route. And that means like if some disturbances are there, or if person is digressing from the topic, so you allow him to digress a little bit, but again, intelligently you bring back that person to the main track. So that's important. Otherwise, you will have many things in your transcript which is not related to your research question. I think. And again, you should summarize in between, paraphrasing, which we discussed. So allow for a natural flow while interview, but again, you should cover all relevant topics. So again, the driving analogy, if there is a low fuel, means that low battery of recorder. If there is a clear road, then it is a smooth interview. If you conduct the interview at a very high speed, then you will get poor narrative. That means you did not enjoy your journey. If it is a very slow speed, then you will have too much of information. That also you don't want, because there will be many information which will not be related to your research question. So it should have an optimum speed, and what speed should be optimum, that you have to decide. It is though there's no such clear-cut guideline. You are your own judge. So while conducting the interview process, you will come to know what a good speed is. So tea break. So during the highway, you take some tea break. So again, this is like a few narratives which are not related to research. Like I asked, like you can allow them to digress a little bit, but again, bring them back to the main track. So again, natural call also the similar analogy, that it is narrative not related to research. And jam is like the participant picked the important mobile call. So in between, I said that because these days everybody is having a phone with them. So in that case, it is similar with the jam when you are having a traffic. When you are riding in a highway and you come across with the traffic, in that case, press the this pause button in your recorder, so that recording, the duration of recording should not be too long. So these are some of the analogy. Again, there's a checklist for the process of quality monitoring of the interviews, and it is shared with you people. You can check with them. So this is one, I think, video. I'll just let me share the sound with you people, and then we can see this. You can keep mentioning the important points. Share the computer. We have shared the interview guide with you people.
Hi, my name is Allison Jones. I understand that you've been to several chart trainings, and I am the qualitative interviewer, and so I'm interviewing people and asking them for feedback about the training and how it went for them and all of that. So is it okay if I talk with you about that?
Yes, of course.
Great. So what is your name?
Shay Bloomer.
Okay. Profession?
I'm a nurse.
Great. And how long have you been a nurse?
I've been a nurse for 12 years.
Okay. Did you enjoy the training?
Yes, I did.
Would you say that you enjoyed it a little bit, a medium amount, or a lot?
I enjoyed it a lot.
Great. Okay. And did you learn something by the training?
Yes, I did.
Excellent. Okay. And would you recommend it to a friend?
Yes, I would.
Great. Okay. So can you give me an example of something you learned? For example, some people have learned that they may think that they're not discriminating and that they're very open and respectful of everybody, but then when they actually get down to it and they go through the training and they understand that there are things that they actually do have some sort of biases in them, and they may not have known it, but then the training helps them discover it and then just helps them be very self-reflective and that sort of thing. Do you think that maybe that's something that you learned in the training?
Certainly, I think some of that was covered in the training. We also learned about taking sexual history and effectively taking a sexual history, which is a sensitive topic, and it's not something that I was trained in my professional education. We also learned about patient confidentiality and the importance of maintaining patient confidentiality in order to protect our patients, and both of those, I think, were very relevant for me.
I'm sorry. Can you say that last part again? I got distracted. I'm so sorry.
Oh, it's okay. I believe I was talking about how we talked about the importance of patient confidentiality and maintaining confidentiality of patient records in order to protect our patients.
You've been talking a lot about what you learned, and now I'd like to ask you a little bit about what you've done differently. I mean, it's one thing to say we learned something, but then it can be quite another thing to actually try to do something differently. So can you tell me anything that you may have done differently because of the training?
So what I'm doing differently since the training?
There must be something that you did differently. I mean, think about it, anything, because you mentioned these different things that you learned about. So can you think about, maybe keeping your voice softer or spending a longer time with patients or being more empathetic than you were before? Anything like that? Do you think any of those may be things that you did differently?
Yes, I'm sure they must think that I'm more empathetic than I was before.
Great. Okay. So now let's talk about the training methodology. Do you think it was effective?
Yes, it was.
Great. And how was it effective?
Well, it was a very interesting training. I was happy to be there.
Great. But it helps you learn and do your work differently?
Well, perhaps.
Now I'm a little bit confused because it seems that you're contradicting yourself. I think earlier you said that it helped you learn and you were doing something differently, but now you seem to be changing your mind. And so now I'm just very confused. Can you clarify for me whether you did something differently because you learned from the training or you didn't?
Well, what I mean to say is that I think that I've always done my job well, and I like my job, and I think that I've always been respectful of my patients, but I think that there are certainly some things that I'm doing a bit better than I did before the training.
Great. Okay. Great. Thank you. So that's all really good. Thanks. So would you like us to provide you with more training on this or any other topic?
Well, yes, actually, there are a number of different trainings that we could profit from at my facility and that I personally would like to attend. I am very interested in a health administration course that's offered in Washington, D.C. At Howard University. I'm also very interested in having some more in-depth training on diabetes, which of course is a large concern for us. I am also interested in taking some further training in care of pregnant women who are HIV positive. there are, I think, a number of trainings that would be of interest.
Can you just say that again? I didn't get that last part.
Pregnant women who are HIV positive?
Okay. Okay. So, what are some of the other problems at your facilities?
Well, one of the concerns that we've been going on and around with the administration about is some of the water issues in the examination rooms. The running water isn't working in some exam rooms, which limits the number of rooms in which we can do certain procedures because the water's not running or there's not. So that's one issue. The water's not working in a number of the exam rooms. I think there's also some communication issues, some systems issues between the pharmacy folks and the people who are in the wards. And I think that it would be useful for the hospital if we were able to have some communication issues resolved between the pharmacy and the ward.
Okay, great. I think it's about time for us to wrap up. Is there anything else you'd like to say?
No, I don't think so. Did I answer all your questions sufficiently?
Yes, just great. Thank you so much.
Thank you.
Bye-bye.
Bye-bye.
So yes, you guys have written, I think, almost all the points. So if you see in the beginning itself, so in the beginning, she was kindly like mostly asking a very close-ended question, the answer to which will be yes, no. And like you guys said that it is, she was not prepared with the interview and she was talking a lot initially also and in between also. So it was like not listening properly, the non-verbal gestures like eye contact, then a lot of other disturbances, seeing the paper most of the time, and then asking like, I did not hear it, can you please repeat? Yes, too much explaining. And I think one person has written, it seems like she's taking Viva in the exam. Yes, because that rapport building was not there. And if you see like the distance, the way she was sitting, it was like, we say like the interview should be leaning a little forward. So she was like most of the time like this, not leaning forward, because when you lean forward a little bit, that shows that you are interested in other person's talk. So all those, verbal and non-verbal, both communication was poor. So yes, and again, she was saying in between, like, I got confused. So she was kind of blaming the interviewee. Like, what do you want to answer? Sometimes you are saying this, sometimes you are saying that, and I got confused. So if you say something like that, ultimately then person will not be very much open for answering rest of the questions. So yes, you have observed this very correctly. Now we'll see a good...
Hi, my name is Allison Jones. I understand that you've been to several chart trainings.
So yes, this is the second one.
Hello, my name is Allison Jones. I understand that you've taken a series of chart training workshops. I'm doing qualitative evaluations about the training so we can learn more about how participants think about their training and what they've learned. So I'd like to ask you about your experience with the chart trainings. Is that okay?
Yes.
Okay, great. Can you tell me your name, please?
My name is Shay Bloomer.
Shay Bloomer, okay. Can I call you Shay?
Yes.
Okay, thank you. And Shay, what do you do for a living? What's your profession?
I'm a nurse.
You're a nurse. How long have you been nursing?
I've been a nurse for 12 years.
Oh, interesting. So first I'd like to start out and just kind of get your immediate reaction to the training, your memories of how it felt to be in the training. What was your favorite part of the training and your least favorite part of the training?
I would say that my favorite part of the training was that the facilitators really took time to have discussions with us, and it was a very open kind of discussion that we had about a number of the topics that we were discussing, and I felt like I wasn't just being told things. It wasn't a one-way sort of experience. We were very much learning from one another, and it was exciting to be in a group with my peers and to be able to discuss the issues that we confront every day and learn different ways of approaching them.
Mm-hmm. I know the training was a while ago, but I'm wondering if in these conversations that you were having with the facilitators and with some of your colleagues, can you remember any particular topic that was especially interesting for you?
Well, one of the topics that we talked about was taking sexual histories. And as nurses who are working in HIV care and in testing, it's often important for us to take a sexual history, but it can be very uncomfortable. For example, depending on who the patient is. We have patients who come in who seem too young for us to need to take a sexual history, patients who frankly seem too old for that to still be relevant. And it was interesting to talk about how we all sort of approach it in a different way, and how a number of us, frankly, were fairly uncomfortable with the topic. But having this kind of discussion about it really helped me to feel more empowered to talk to all of my clients about their sexual history.
So I heard you say that you're now taking these sexual histories differently. And I'm wondering if, because you're taking them differently, if different kinds of information actually comes out from your consultation with the patient.
Yeah, I think certainly, because the truth is that I was so uncomfortable doing them before that I often sort of skipped over it, or found ways to just ask yes/no questions and get through it. And so now that I'm more comfortable taking the history, I'm actually doing it with all of my patients.
Can you think of any ways that that might affect the actual care the patients receive?
Definitely, because before I wasn't thinking about a number of these patients in terms of needing the kinds of services like HIV testing, and now I realize that the elder generation is sexually active, and I'm taking their sexual history, and some of them do need to be tested.
Can you tell me anything else that you remember learning from the training?
Well, one of the things that we discussed a lot at the training was patient confidentiality. And I feel like I was aware that confidentiality was important. I was not aware of the many ways that we can accidentally violate patient confidentiality. And it's caused me not only to look at my practice personally, but to also be thinking about the way things sort of happen in our clinic, because there are a number of things happening in our clinic that I actually think are making it harder for us to maintain patient confidentiality.
So I think we will share this. You can see this video since this is a little longer, but you must have realized the difference between the first interview and the second interview. And all of you have correctly written that rapport building regarding the position of the a person who is taking the interview, the eye contact, the listening part, giving the time to interview, probing more on a particular question. And she started with a very broad question and then coming to specific ones. So again, there is a difference between the key informant interview and in-depth interview. So key informant are the experts basically for a particular topic, like regarding the RSV vaccine. The key informant for us were the immunization officers, where they were the district immunization officer or the state immunization officer. It can be like the mukhya, the school teacher, the local leaders, or in case of a hospital, it can be the administrators. In PHC, like we took interview of the, in case of a district, with the civil surgeon, with the deputy superintendent, medical superintendent. So these are the informant. They might not be representative of the community, but they will give you a real insight into the problems, especially if it is related to some health system problem. So other processes are again the same with the like key informant versus in-depth interview. The only thing is that, with the key informant interview, like Latika was saying, many times they don't allow us to record, but still you can take the notes while taking the interview. And again, you should send them their transcript over the mail, just as a member checking. So breakout room activity, we are planning to see how we can do it, because I'll first explain you the process of transcription, and then we will decide on this breakout room activity. So once you have taken the interview, now how to do the transcription. So transcription is, again, it is a process where you have all the interviews, data is saved in your computer, you have shifted it to your system, then you should have a log of that. transcript, like on a particular date, what transcript, whom you took, it lasted for how much time. We'll share the Excel sheet with you people, which will have all these format, like how you should be taking the records of these transcript. Now, there is something known as the exact verbatim and there is something known as the clean verbatim. So exact verbatim is like if the person is pausing in between, like saying, or, taking a big pause or a big silence is there, or patient is making faces or not liking something. So if such emotional part is there, which will not come in the recording, then you can record that as a part of note taker also, and in your transcript also you can like mention where the patient was saying such things. And clean verbatim is only the language which the patient has said. So it depends on the research question. If you are doing something like ethnography or taking the interview for the grounded theory, then you may include those things. But if you are doing a descriptive qualitative research or your research is related to some health system, then you can go for a clean verbatim where you only focus for the sentences which the participant has said and not on the emotion part and the interruptions in between. Again, coming to the timing it takes. So what is the rough guess for you people? Those of you who have done it, you can write it very clearly, like transcribing 1 minute of of audio takes how much of time? How many minutes? Yes, 5 minutes. True. It's 5 to 6 minutes. And then if 1 minute of, if there is a 1 minute of audio recording and 1 minute of video recording, how much will it take the same time? Will it take the same time? And which will take the more time, video recording or the audio recording? So generally it is the video recording which takes more time. Like, yeah, true. Because you have to see it, and then otherwise listening and doing the transcription is easy. So easy matlab as compared to the video one. So you should write the following information on the first page of the transcription. Why? Because when you see the file later, or many times what happens, like you have got a research team and you ask someone else to do the transcription, then definitely you should have these name of the respondent, name of the interviewer, name of the note taker, name of the facilitator, date of the interview, site of the interview, transcription done by, and if it is in, generally it is in local language like Hindi, and then you do the translation. So is it being done by the same person or by some other person? It should be there in the first page. And then
Is it advisable? Is it advisable for somebody else to do the transcript since he or she is not involved in the interview process?
actually it depends how lengthy is the project is. So like we I said to, like we did it in 26 districts, and there were like 76 FGDs. So it was not possible for us to do it. The researcher could not do it. Yes, if it is like 10 to 20 transcript and it is a personal thesis or a project or a PhD thesis, then definitely ideally the person who took the interview has should do the transcription. That's
right. Okay.
That's
so the other people who do the transcripts, you need to hire them, right? Independent.
Yes, there are people who do it like we, in our budget also we pay them like this many for these many minutes at the rate of something like that. We have paid for one project. We had that hiring process was there, and then your role is to check the transcription in between. I'll say the way they should do the transcription, so that you can check the section of transcription to check its accuracy.
So does one sign a NDA with them, a non-disclosure agreement with an outside person who does the transcript?
Generally that was we did not do here in India, because
but advisable probably.
Yeah, it should be done. And then on the second page, there should be the summary of interview in approximately 500 words. And then once you start doing transcription and you are stuck up at some point, then if you wish to revisit that point later, how will you proceed further? So this question is asked only showing this. So can you see this time span? So your interview should be in time span. And like we have done like this for many of our interview, where we have divided the sections and like 0 to 5 minutes, 5 minutes to 10 minutes. That is a rough guide. But it should not be like if the 5 minutes is finishing earlier, like if some response is getting finished at 4 minutes and 44 seconds, then you can have that much time span. Okay, so it is roughly like in an interval of 5 minutes, and then it is easy for you to do the transcription check. So like what we generally do, we check the initial part, then we check in between something, and then again you can check some segment of last part. So that way you can check the transcription. And if something is not audible in the transcript, you can write in the bracket, like this is not clear. And there are software also which are available, like Transcriptor is one software. But again, for that, the audio quality should be very good. Then only it transcribe. So you can take help of that. You can have a rough transcription using that transcriptor. And then again, you can refine it, listening to it once again, and then refining your transcription. So that can also be done. We did it for one of our projects. Now, one more slide on the missing data in case of a quantitative and qualitative. So this is one quantitative data. You can see the variables like age, sex, locality, and duration of diabetes, and number of molecules that person is taking. So this data set is 1, and this is the data set 2. So if you see the data set 2, what is the difference between data set 1 and data set 2? Yes? Can you please see and type? What is the difference? So basically, you can see there are missing data. Here also there is a missing data. It is a missing data. So similar, if you see this, yes, you are right. If you see this transcription, then what can you see here? Yes, can someone tell us the difference between the first, this transcription, this interview process, and the second one? So you can see the response here. That the person is asking, can you describe how managing your diabetes impact your daily routine? So the answer is this big. So you expect these big responses, then only you will have something to analyze. So if you have like only one sentence, like this person is saying, this is a kind of missing data. Or if the person is asking yes, no, this is a kind of missing or incomplete data in case of a qualitative. Because again, I said that in qualitative, the words and sentences are the data. And if that is not there, you cannot analyze anything. You cannot conclude anything. So it should be a rich transcript. So I think this was the process of transcription. So now there is a matter to decide that we thought initially that we'll open the breakout room now, and you all have to take interview of each other. Like there will be 2 people in each room, and we have finalized the interview guide, what you people have made in each breakout room. So using that interview guide, all of you have to take the interview of each other. Like if 2 persons are there in one room, you can take interview for 15 minutes, or maybe you can take for 10 minutes. And one person will ask the question to the next person, and then next 10 minutes, the role will be reversed. The person who was the interviewer will be the interviewee. So this activity, we can do it now, or if you feel we can do it tomorrow also, we'll open a breakout room tomorrow, those many breakout room, and you people can conduct the interview, and we can give you the recording rights. So you have to record the interview, and you have to make the transcript, because we will do the data analysis on that transcript.
Madam, I have one query. That
Yeah.
question is for practicing doctors. So I am a non-clinical person. So how would you respond to that?
You can during your internship time, or what, you can be a simulated doctor in this case. Maybe even if you are non-practicing, related to communication, I think you must have some idea related to that.
Yeah,
If
I do have idea. I can't share my own experiences. That's why.
it's see again, come very nice. If it is a phenomenology, then you have to share your experience, because remember that question you. But in this case, if it is a grounded, see, then you can tell about the processes also. It is not necessary that you have experienced this, right? If a person is there in the biochemistry or in some other department, it may not be like Dr. Abhijit is writing, non-lived experience. Yes, because many times you take the interview, I have heard, I have someone in my family, or I have friends with me who keep on sharing the things related to patient communication. So I have a fair idea. So I may not have experienced it now. Maybe I have experienced it some time back, or I have a fair idea regarding, if like you are patient many times, you can tell from that perspective. As a doctor also, you have to go to many, like as a patient to many doctors. So you have those ideas also. So yes, it can be lived versus non-lived. Is it clear, Dr. Dhanya? Okay, so for tomorrow, we will communicate. Dr. Jalinder said on for Monday. But for Monday, since we have to start with the data analysis, so you guys have to finish the activity tomorrow, doing the interview and making the transcript.
Open the breakout room for between 9 to 10, but they have to make.
Okay, so Dr. Shamshad is saying that on Monday also we can open the breakout room, but in the first half, from 9 to 10 in the morning. So what you people can do, those of you who can do the interview tomorrow, you can do it tomorrow. Those of you who want to do it on Monday, we can do it on from 9 to 10. Oh, we can take the, like Dr. Shamshad will take the poll, who all want or who all wants for tomorrow or time slot. We will open the breakout room and we'll share the recording rights. So do record that interview, and then you have to transcribe it. Then we'll start the process of like data analysis from Monday. Transcriptor, it is the transcriptor. But don't do it right now. We'll tell you after you do with this transcription process. Otherwise, that nuances you will miss. Again, transcriptor is a AI. So you know the problems with AI. They will have their own issues. We'll discuss these issues. We'll tell you the name. Name is transcriptor only. It's named that, I think Dr. Shamshad wrote it in the this thing. We'll give you. But it's better that first learn it how to do it, and then you can use that also. Okay, then we are ending meeting. So any activity for today's? Okay, we'll communicate. Oh yes, so the activity we have just narrated you, and we'll communicate. Dr. Shamshad will communicate to you people. So okay, good day to all of you. And we are meeting on Monday at 2. At 2, should we meet early? Okay, 2 p.m. Thank you so much.